Greg. Greg, you need to come home. I don't know what's going on. Come home right now.
Hi, Mrs. Sylvia. My name's Meredith. I'm going to be your nurse. It's nice to meet you.
Nice to meet you too.
So, what brings you in today?
Well, I was home and I was cleaning my kitchen, and all of a sudden I felt very dizzy, and I felt like my right side got numb. And so I sat down and I called my husband, and he asked me what was wrong, and he couldn't understand what I was saying. He said my speech was very incoherent and slurred.
Okay, so you had right-sided weakness, you were lightheaded, and your speech was slurred.
Yes.
Okay, so after that, after you got off the phone with him, what did you do?
We decided to come here and get some help.
Okay, so how long did your symptoms last after you and your husband left for the hospital?
They lasted about 20 minutes.
Okay, so overall, how long total would you say your symptoms lasted?
Overall, I would say a half hour.
About a half an hour? Okay, so did you have any other symptoms beside your lightheadedness, right-sided weakness, and slurred speech?
I did have blurred vision.
Okay, so some blurred vision. Okay, and are you feeling any of those symptoms right now?
No, I just feel really tired.
Okay, and have you ever had any similar incidents to this one?
Never.
So I'm just going to ask you a few other questions about your history and medications. So right now, are you on any medications?
I'm not on any medications, but my doctor says I have high blood pressure, but he hasn't put me on any medication yet.
Okay, and how long ago did your doctor confirm your high blood pressure?
About 3 months ago.
Okay, and do you smoke?
No, I don't.
And do you have a history of diabetes?
My uncle has type 2 diabetes.
Okay, and also, have you been under a lot of stress lately?
I actually have. My mother's been very ill, so I've been taking care of her, so that has been...
The stress of taking care of your aging mother, okay. And what do you do for a living?
I'm a teacher.
Okay, so now that I have that background information, I'm going to do a quick physical examination on you and check some of your motor skills, okay? All right, Mrs. DeSilvia, we're going to start your physical assessment, okay? So first I'm going to check your pupils. Good? All right, great. Next, I'm going to have you stare at my finger right now, and then you're going to follow it in as it comes to your nose, and then follow it back out, okay? All right, good. So, next, I'm going to have you smile with your teeth. Stick your tongue out. Good. And now I'm going to have you say some funny sentences, okay? Just to make sure that that slurred speech is cleared up, even though we've been talking. You don't sound like you're slurring, but... All right, so can you say near the table in the dining room?
Near the table in the dining room.
Good. What about they heard him speak on the radio last night?
They heard him speak on the radio last night.
Excellent. Okay, now can you turn your head to the right? And turn your head to the left? Good. And now can you shrug your shoulders up and down? Perfect. So next I'm going to check your muscle strength just to make sure that it's equal on both sides since you were having that right side weakness.
Sure.
So go ahead and put your arms like this. I'm going to pull against your arms, don't let me pull.
Okay.
Good. Now push against my hands as hard as you can. Good. Okay. Next I want you to go like this with your fingers. All right. Looks good. All right, next, I'm going to have you hold up both of your arms like you're holding soup, and hold them there and keep them there. Don't let them fall. Excellent. All right, so next I'm going to have you lay down. You go ahead and swing your legs up. Okay, can you hold your left leg in the air and don't let it fall? Good. What about your right leg? Hold it up and don't let it fall. Excellent. Okay? So now I'm going to test your motor strength again, okay? So I'm going to have you push like you're driving a car, push against the gas. Good. All right, now we're going to push back on my hands and try to lift up your toes. Good. All right, you can go ahead. All right, Mrs. DeSilvia, now I'm going to have you sit up all the way and stand up. I'm going to assess your gait and the way you walk. So I'm going to have you take 5 steps forward, and then you can turn around and take 5 steps back towards me. Okay. Okay. All right, it looks good, thank you. Okay, Mrs. DeSylvia, so based on your labs and the physical assessment and assessment we did today when you came in, we believe what you had was a TIA or a transient ischemic attack.
That sounds really serious. What is it?
So a TIA, it's a short interruption of blood flow to your brain. Ischemia just means a reduced blood flow, and basically your tissues weren't getting the oxygen that they needed. So this lack of oxygen explains why you were lightheaded, why you had right side weakness, and the TIA explains your slurred speech. So because your episode only lasted around 30 minutes, we're confident that you'll make a full recovery.
What caused the stop of blood flow?
Well, sometimes we see TIAs or these episodes in patients who have high blood pressure, high cholesterol, diabetes, and other patients with chronic health issues. I know we had discussed that your doctor had diagnosed you with high blood pressure, so that could be something that caused the attack today. But besides your high blood pressure, you're very healthy, and I think with a few minor lifestyle changes and medication for your high blood pressure, that this could be a one-time incident.
So, I'm sorry, I'm still confused. What exactly is it, and why does it cause the blood to stop flowing?
So a TIA occurs when there's sort of like, I guess you could compare it to a traffic jam in one of your blood vessels. There's either a small clot in the vessel or the vessel constricts, so the blood can't get through and circulate to your body like it needs to. So this lack of circulation results in a lack of oxygen getting to your tissues and needing to get where it needs to go. So when it comes to a TIA, you couldn't get enough oxygen to your brain, and that's why you had your symptoms such as your slurred speech, your right-sided weakness, and your confusion. Obviously this isn't normal, and this isn't what we want to happen because it can cause irreversible damage.
So, did I have a stroke?
So yes and no. A TIA, it's sometimes called a mini stroke. However, it's not as serious as a stroke, and you didn't have any permanent damage to your organs. However, you do need to be careful because a lot of times TIAs are warning signs that a bigger stroke is to come.
What do you suggest I do?
So we're going to put you on an anticoagulant drug, which is a blood thinner to keep your blood thin so that it can flow through your body and there are no more of those traffic jams. We also want to make sure you're getting all of your nutritional needs. So how would you describe your diet normally?
Well, my husband and I, we eat pretty healthy. We have a small garden, so we eat fresh vegetables all the time. We try to eat fish, stay away from meat, and just basically overall very healthy.
So that's great. It's really important to maintain a good diet. Eating healthy is one of the best ways that you can prevent this from progressing any further.
Okay.
Also, you should do around 30 minutes to an hour of exercise a day. It doesn't have to be anything strenuous, but just something to get your heart rate up and pumping, and that'll make your heart muscles stronger. Also, you don't smoke, which is good.
I'll definitely try to get some exercise in.
Okay? So, if you ever have any of these symptoms again, well, what we tell our patients to remember is FAST. So, you have facial drooping, arm weakness, slurred speech, and the last one is the most important, that's T, time to call 911. So when something like this happens, when your oxygen isn't getting to your brain, it's important to get to the hospital as fast as you can because we also like to say time is tissue. When that brain isn't getting when your tissues aren't getting oxygen, they can start to essentially die. So it's just important to get to the hospital as fast as you can. Okay. All right, Mrs. DeSylvia, so that's pretty much it. Right here I have some papers for you just outlining again what a TIA is and some of the recommendations that we've made for you. Feel free when you go home, share this information with your husband, and if you have any questions, do not hesitate to give our office a call back, and we will be happy to answer them. Do you have any other questions for me?
No, thank you.
Okay, so here's those papers,
Thank you.
and it was nice meeting you, and good luck to you.
Thank you.